तुम्ही पळयतात प्रुडंट. You're watching Prudent.
नमस्कार येवकार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक म्हजो मायमोगाचो येवकार. इश्टानो, आमचो मोस्ट निग्लेक्टेड भाग आमच्या कुडीचो जावन आसा आमचे दांत. जो पर्यंत आमचो दांत दुखना, आमकां दांताक कीड किंवा कॅविटी पडना, आमी दांताच्या दोतोरा कडेन वचची ना म्हूण आमी आमच्या दांताची काळजी घेना. सो हांवें जें उलयलां तेजें तुमकां कळटलें की आयचो एक्सपर्ट, आयचो तज्ञ, आयचो दोतोर आमच्या कार्यावळीन कोण आसा तो. सो पळोवया आयच्या दोतोराचो एक ल्हानशी वळख.
हायर सेकंडरीचे शिक्षण जेवेस हायर सेकंडरींतल्यान पुराय केलें. त्या उपरांत तिणें डेंटल सर्जरींतली बॅचलर्साची डिग्री गोवा डेंटल कॉलेज अँड हॉस्पिटल हांगासरल्यान मेळिल्ली. 15 वर्साच्या डेंटिस्ट आनी ऑर्थोडॉनिस्टाच्या अनुभवा बरोबरूच ती इम्प्लांटॉलॉजी आनी लेझर डेंटिस्ट्री हेतून प्रमाणीत आसा. हालींच तिणें इनविजिबल इल्युजन अलायनमेंट ही दात सरळ करपाची डेंटल प्रॅक्टीस चालू केल्या.
डॉक्टर नादिया, वेलकम टू द शो. इश्टानो, तुमच्या दांता बद्दल कितें तुमकां ह्या विशयाचेर तुमचे कितें प्रश्न आसा, तुमचे कितें क्वेश्चन्स आसा ते तुमी आमकां फोन इन करून विचारूं शकता. आमचे फोन नंबर जावन आसा 24904444 आनी 24904445. त्या भायर आमचे सोशल मिडिया प्लॅटफॉर्माचेर फेसबूक लायव्ह आनी यूट्यूबाचेर तुमी तुमचे प्रश्न मेसेज चॅट बॉक्साचेर विचारूं शकता आनी आमी तुमकां त्या प्रश्नाचो उत्तर दितले. सो डॉक्टर नादिया, वेलकम टू द शो.
Thank you very much, Dr. Stacey.
Just to start, I would like to know when is the first time we should actually visit a dentist, because we don't visit a dentist until we have some problem with our teeth. So पर्यंत आमकां दांत दुखना, आमचे दांत किडेना, आमी डेंटिस्टा कडेन वचना. सो तुज्या हिसपान when should be the first time we should visit a dentist?
Okay, पहिली फावट म्हणजे जेन्ना आमी ल्हान आसता तेन्ना. The first visit to the dentist should be when a child has all his milk teeth. म्हणजे ते 2 वर्साचे आसतना तांकां पयली डेंटिस्टा कडेन व्हरूंक जाय, कित्याक तांकां ते आदत जावंक जाय. They have to get used to seeing a dentist who will be gentle and check their teeth.
Right.
And then it is every 6-month process to get to know the dentist. आनी कितें जरी तर ल्हानशे दांतान मेळटा जाल्यार ते पयलींच आमकां बरे भाशेन ट्रीट करूंक जाता.
Okay. So milk teeth and permanent teeth, by the age of I think 10 to 12 years we have permanent teeth popping out. So what is the care that we should take for milk teeth? Because most of the time parents say दुधाचे दांत ते पडटले, तेका घेवन बसपाचे ना, किडेवनी दांत, ताचे चड लक्ष आमी दिना. So what is the care that we need to take of milk teeth?
Actually, Dr. Stacey, आमचे पयलो दुधाचो दांत येता तो आमी 5 वर्सां आसतना. पहिली ती एक आमची दाढी दांत पडटा, फुडलो दांत सकयलो.
Yes.
So the first milk tooth that falls
Permanent
out
tooth,
is at 5 and the permanent tooth comes at 5. त्यात वेळार पहिली परमनंट दाढी येता फाटल्यान आनी खूब पेरंट्साक लागता, आवय बापायक लागता की तोय दुधाचो दांत. सो वी हॅव टू नो दॅट इट इज व्हेरी इम्पॉर्टंट की आमी सगळे दुधाचे दांत सारके दवरता. कित्याक दुधाचे दांत पडटकूच न्यू येता. दुधाचो दांत ना जाल्यार सगळे मागीर वांकडे जाता, दांत दुसऱ्या दांताच्या जाग्यान येता आनी मागीर खूब प्रॉब्लम्स जाता. सो दुधाचे दांत खूब गरजेचे आनी ब्रश करपाक जाय. आनी जरी तर आमी तेंचो केअर घेना जाल्यार समज भुरग्यांक कितकी दूख जाता कीड लागतकच. म्हणजे इट्स व्हेरी इम्पॉर्टंट टू टेक केअर ऑफ युअर मिल्क टीथ.
So when is the ideal age that we should start brushing teeth in kids? When do we start,
Actually,
oral care?
Okay. आमचे बेबीक जेन्ना पयलो दांत येता न्हू तेन्ना आमकां खूब खुश, वी आर व्हेरी हॅपी.
Yes, it's almost celebrated.
सो पण कितें जाता तेन्ना दुधाचे तांकां दूध दितात. सो वॉट आय टेल माय पेरंट्स इज कॉटन घे, उदकान बुडय, स्क्वीज द कॉटन अँड क्लीन युअर चायल्ड्स टीथ.
After every feed?
Mostly, especially like in the night when they sleep, get used to that. So we have to start cleaning our children's teeth right from the time the teeth come into their mouth.
Okay.
आणि मागीर ते व्हडले मातशे 2 years जातकूच तांकां ब्रश करपाक शिकोवंक जाय. टूथपेस्टाची चड गरज ना, पण तांकां सारके ब्रश करपाक शिकोवंक जाय. आवय बापायन पयलीं ब्रश करूंक जाय, मागीर भुरग्याच्या हातीन दिवंक जाय. हय.
Okay. So that inculcates a good habit from beginning. So how many times do we need to brush our teeth? Some people say after every meal. थोडी जाणां म्हणटात सकाळचे घासूंक जाय, रातीक न्हिदच्या पयलीं घासूंक जाय. What is according to you the correct thing to do?
You are correct. Actually आमकां सगळ्यांक 2 फावटी ब्रश करूंक जाय. म्हणजे ब्रेकफास्टा उपरांत, ब्रेकफास्ट जावन आमी ब्रश करूंक जाय.
Not before breakfast.
बिफोर ब्रेकफास्ट. नाव वी लिसन टू द थियरी. आतां राती आमी ब्रश करूंकूच जाय न्हिदचे पयलीं, कित्याक तें जेवण जें शिरकता तें साफ जावंक जाय. So after you brush at nights, when you wake up in the morning, you only have the bad breath because ती थुकी आसता ती ड्राय जाता. So कितें करूंक शकतात म्हणजे आमी वी कॅन रिन्स आवर माउथ, उदकान गोट घेवंक जाता, आनी मागीर ब्रेकफास्ट करून ब्रश करूंक जाय. कित्याक ब्रेकफास्ट जावनूच आमच्या दांतान खूब जेवण बी भरता, आनी ब्रेकफास्टा पयलीं ब्रश केल्ले जाल्यार कांय उपयोग आसचो ना. डीके एसीड आमच्या दांतान स्टार्ट जाता. हय. आनी तशें खूब लोकांक कॅविटीज जाता. सो माय ओपिनियन इज आफ्टर ब्रेकफास्ट एंड आफ्टर डिनर. तुमकां जाय जाल्यार आफ्टर गेटिंग अप इन द मॉर्निंग ब्रश करूंक जाता, but after breakfast is very important.
And I think you should gargle your mouth every time you
yes, that is
eat
a very good
something,
habit. Correct.
After every meal.
Yes, very good habit, because you remove whatever extra is there in your mouth, and it doesn't get that acid formation soon, which will spoil your teeth.
Which will cause decays and cavities.
Which will cause, yes, दांत पिड्या जातले. कित्याक दांतान एसिड जाता. आमचे जेवण बॅक्टेरिया तेजेर डायजेस्ट करता आनी एसिड जाता. हय.
So doctor, what are the foods that cause teeth decay? म्हणजे आमचे दांत जे किडेता ते खंयच्या जेवणा खातीर जाता अशें तुका दिसता?
आमचे मोस्ट फेवरेट फूड न्हू ते चडूच वायट. कितें सांगू? बिस्कीट, केक्स, चॉकलेट्स, हे सगळे.
Anything sweet and sugary.
हय. And cold drinks, very bad for our teeth, because that is what causes the acid decalcification, which then causes cavities and then tooth pain. So the big no-no is everything we love.
Yeah.
But there are also there are also foodstuffs that can help us prevent little decay. Okay, so it's like, cheddar cheese. Cheese खाल्ल्यार बरें आसा. चपाती की पाव खंयचे बरें आसता? चपाती बरें आसता. पाव खूब लागता, दांतान शिरकता. चपाती तशें करना. So chapati is better than pav. And better to eat peanuts. केन्ना peanutsय बरें जाता.
विकणा आमी म्हणटा.
Yes, correct, absolutely right.
So doctor, there is something called as flossing also. Is it different from brushing, and is it a procedure that you can do yourself, or you need to go to the dentist to do it?
Flossing is something that is quite easy once you get used to it. पयलीं आमकां संवय जावंक जाय. कितें न्यू आसता तें आमकां मातशें त्रास जाता पयलीं करपाक. Flossing maybe after 18 is something that I advise. And after 18 years.
Something that you would recommend.
Yes, I recommend. कित्याक जशें आमी एजीन वाडटा दांता मदीं वेर जाता म्हणून जेवण शिरकूंक लागता. सो ते काडपाक आमकां फ्लॉसाची गरज आहे. फ्लॉस म्हणजे डेंटल थ्रेड, सूत कशें आसता तें. And there is a certain way that you have to learn from your dentist how to use it. Yes.
I think based on your teeth set and.
Yes, and how much force you have to use. And it is a very good habit. Maybe flossing at least every alternate day.
Right. So on this same lines, doctor, I want to ask you, how long do you have to brush your teeth?
That's a nice question.
That's an important thing, because sometimes in the morning we are so much in a hurry to get along with our day. So brushing is like, just fast and you move on. So is there a set time that you need to take to brush your teeth?
Actually, it is 3 seconds per surface of the tooth. Okay. And each tooth has 3 surfaces. So 9 into 28 at least. So that's a long time.
Yeah.
But at least we should brush for a minute nicely. 1 minute carefully. Okay. And after we brush, I suggest move your tongue all around your teeth. Okay, that is one trick.
Okay.
खंय तुका रफ मेळटा जाल्यार तो दांत मेळ्ळो आसा. So then take your brush and gently brush there again.
So it's not just like a routine task, it's something that you should actually pay attention to. Like
Right.
you would normally do your makeup and ironing your clothes or something
absolutely, absolutely. केन्ना केन्ना ब्रश करतकूच जेवण दिसता.
Zen.
तर हारश्यान पोवन सारकें पोवंक जाय. ओके, इज इट रियली क्लीन? मूव योर टंग ऑन योर टीथ. रफ आसा गाय, थंय म्हाका दिसता जेवण शिरकला की कितें डिपॉझिट आसा, तेन्ना परत ब्रश करूंक जाय. ओके.
Okay. तर bad breath आम्ही जे म्हणता न्हू, what are the reasons for bad breath? Is it because you have a cavity or because of any other reasons that you could have bad breath?
So bad breath, yes, is caused by cavities. One, okay, cavities astana jevan shirkata, that smell comes from the dirty and the decayed tooth. तो दान जो पिड्या जाता थंयसरल्यान स्मेल येता. मागीर आमच्या तोंडान केन्ना ब्रावन कलर डिपॉझिट्स जाता, ताकाय लागून बॅक्टेरिया चड वाडटा. आमचे गम्स न्हू ते ब्लिडींग जाता आनी तेन्ना खूब वास येता. केन्नाय केन्नाय लोकांचे दांत साफ आसता, तोंड साफ आसता, पण तरी तेंच्या तोंडान वास येता. तेन्ना तेंच्यांनी पळोवंक जाय की हांवें कितें वेगळें खाल्लां काय, आमचें डायजेशन सारकें जावंक ना. So that is also another thing. But first is cavities, second is bad gums due to collection of dirt, that brown colored dirt which is there in your teeth.
Okay. Before we move on to the next question, I would like to remind our viewers, आमचे फोन लाईन्स ओपन आसा. तुमचे कितें प्रश्न आसा दांता विशीं, दांताच्या दुयेंसा विशीं, तुमी आमकां विचारूं शकता. आमचे फोन नंबर आसा 24904444 आणि 24904445. सो बॅड ब्रेथाच्या बद्दल आमी उलयताली दोतोर. Smoking, drinking coffee, does that also result in bad breath?
Yes, smoking causes a lot of dryness in the mouth. And also if you are a chain smoker, magir te automatically it comes from your deep breath. And yeah, it doesn't, जेन्ना आमी ते सगळे bad habits आसता, smoking, गुटखा, पान, okay, drinking, मागीर आमी दांत साफ करपाक टायम घेना आनी ते डिपॉझिट जाता आनी ते कॅल्क्युलस टाटर ते सगळे जाता तोंडान आनी मागीर वास येवंक लागता. सो मोस्टली इन पीपल हू स्मोक, ड्रिंक टू मच ऑफ कॉफी एंड टी and drink alcohol, pan, gutka, we see this problem. Lot of bad breath issues, and also they have other serious issues like different oral ulcers,
Yes.
in their mouth, and sometimes even cancers.
Okay. दोतोर तुम्ही जसे आता म्हणला ulcers, what are the causes of ulcers in the mouth? Is there a particular reason that we get mouth ulcers?
The most common cause of ulcers is a sharp tooth, actually.
Okay.
कितें लागता जाल्यार थंय आमकां घावो जाता, and ulcers is very bad. We must not let an ulcer be in our mouth for more than 7 days. जरी तर तुमच्या तोंडान अल्सर घावो मेळटा जाल्यार प्लीज डॉक्टराक दाखय. हां, तुमच्या लागशिल्ल्या डॉक्टराशी दाखोवंक जाय, कित्याक ते खूब गरजेचे. पयलींच आमी चॅक करूंक जाय ते.
Because we have to identify what is the
Yes.
reason of ulcer. Sometimes it can be something worse also, like
Yes.
cancerous.
येस येस. केन्ना केन्ना दूख आसना आनी घावो आहा तेन्ना ते मातशें तुमकां ओके देर इज अ प्रॉब्लम, वी हॅव टू शो द डेंटिस्ट. दूख आसना जाल्यार प्लीज डायरेक्टली गो टू द डेंटिस्ट एंड शो. Another reason why ulcers are formed is also some people have vitamin deficiency. So तेंकाय अल्सर जाता. मोस्टली भुरग्यांक आमी पळयता की तेंच्या तोंडान ल्हान ल्हान भुरग्यांक दांत साफ आसा पण अल्सर्स जाता आनी ते खूब दुखता तेंकां. दॅट इज अ विटमिन डेफिशियन्सी ऑर एन एलर्जी. केन्ना केन्ना आमकां कळना की कितें खाल्लें जाल्यार अल्सर घावो जाता तोंडान. सो तें पळोवंक जाय कितें वेगळें खाल्लां काय, or have you tasted something new, or have you changed your toothpaste, or have you put something in your mouth?
Like a local reaction to something that you're eating or using.
Yes, absolutely, yes.
So doctor, we have a question on social media. Is it a concern if there is a cavity for a child of age 6, or will it get rectified as the new tooth comes?
It is a big concern if there is a cavity for the child at age 6. you have to get that treated as soon as possible. If it is on a milk tooth, remember, sometimes those teeth stay till the child is 12 years old in their mouth. And the small cavity becomes a big cavity, it goes into the nerve, and the poor child will have a lot of pain, and the parents will be in distress.
Yeah, because most of the time we tend to ignore milk
Yes.
teeth with cavities.
Yes, most of the times, sadly, very sadly.
Yes. So, doctor, would you recommend filling of the tooth in case of milk teeth, or what is the
Yes.
treatment that
We
you would-
have also dentists who are specialized in child dentistry,
Okay.
and we have some general dentists also who are very good with children. So you have to take your child to someone you are recommended to who is good with children. To treat a child is difficult.
Yes,
You have
because
to be
they're-
their friend,
Yeah,
you know.
right. They'll need some special attention, special
Yes.
care. So, doctor, what is wisdom tooth? Like, is it that, that everybody has to get their wisdom tooth? Sometimes they have to, extract the wisdom tooth. So, give us some insight on wisdom tooth.
Wisdom teeth म्हळ्यार अक्कल दाढयो. ओके, and अक्कल म्हणजे
But it
काय
has
ना
any connection with wisdom? No, not
तितून
really.
काय कनेक्शन ना. आणि ते सगळ्याकीन लास्ट येता. केन्ना केन्ना आमच्या जॉज मदीं ते जागो ना जाल्यार खूब दुखूंक लागता भायर येतना. आमचे सकयले दांत लास्ट टूथ. Okay, that is the wisdom tooth. If there is place in your jaw, magir, there is no problem. But
Yeah.
most of the times, आमच्या 28 दांत जातकूच 29 दांताक जागो ना. तेन्ना खूब दूख जाता, पेशंटाक खूब प्रॉब्लम जाता. So we ask them to remove the teeth then, when it is of no value.
Okay. Doctor, many times it is seen we have patients who come with bleeding from the gums. Is there a particular reason why there is bleeding gums?
मोस्टली आमच्या दांताचेर कितें डिपॉझिट लायट आमकां जे आमच्या दोळ्यान दिसना तसले डिपॉझिट आसता. इट इज अ फिल्म. जरी तर आमी ते सारके ब्रश करना मागीर ते हार्ड जाता. दॅट इज कॉल्ड टाटर. आनी वेन दॅट इज कॉज्ड द गम्स बिकम सॉफ्ट. यू कॅन सी sometimes if you see in the mirror,
Like mushy,
yes,
whitish gums.
whitish, or they're dark pink, and if you just touch them they start bleeding. It is because of that tartar.
Okay.
कित्याक ताजे वयल्यान खूब bacteria बसून आसता, and it changes the quality of your teeth and your gums.
So
that has
could
to be
lead bleeding.
treated. Actually, if you go to your dentist every 6 months, the dentist will check and see and tell you your progress, whether you need cleaning of your teeth, whether you have brushing well, and if you need any help, the dentist is there for you.
Right. So many times we see a lot of children and even teenagers wearing braces. So what is the role of braces in your in teeth?
In teeth.
What do they help in actually?
Okay. Now there
What
are, sorry?
No, yeah.
So there are two types of braces done. In the sense, one is when a child has a problem with their jaws.
Right.
तेंचे जरी तर माव सारके वाडना जाल्यार एक भाशेचे ब्रेसेस आसता. And the second type is done if your teeth are crooked or there is a problem only with your teeth and not with your jaws. जरी तर तुझे जॉजाचो प्रॉब्लम आसा जाल्यार then that is before puberty that we have to do the treatment. Suppose it's a simple treatment of teeth aligning, making it straight, closing the gaps. That can be done at any point of time post puberty. But for jaws treatment, केन्ना पयला जाल्यार धाकटी भुरगीं तोंडान बोट घालतात. मागीर कितें जाता तेंचो वयलो जॉ भायर येता आनी सकयलो जॉ भितर वता. So first thing we have to do is that is a bad habit which we have to stop. So there we use preventive orthodontics, preventive braces. केन्ना ते लेट जायत जाल्यार आमकां ते the jaw is growing like this. The upper jaw grows outside and the lower jaw is inside. So there is a special way of having braces to correct that as much as possible.
Right.
Because if you don't do it when the child is young, then you cannot do it in between. You have to directly go for something new that is called orthognathic surgery, which is correction of your jaws and teeth with surgery.
Which is much more expensive and much more
expensive, advanced, scary, difficult to make a decision.
Right.
So it's important that you're guided correctly. जरी तर जॉजाचो प्रॉब्लेम आसा जाल्यार ते pre puberty, before a child is around 10 to 12, the treatment has to be done. फक्त दांताचो ट्रीटमेंट जाय जाल्यार क्रुकड की स्पेसिंग तेन्ना ते केन्ना करूंक जाता.
So I think this would be more clear, like you said in the beginning. आमी जर आमच्या भुरग्यांक 6 months of age ह्या एजीरूच dentista कडेन व्हरत, so then the dentist will be able to, accordingly guide us whether the child needs braces, whether the child's jaw is properly aligned or not. Is it not, doctor?
Yes, from 6 years onwards we can see how their progress is.
Yes.
And by the time they are 8, 9, 10, we'll know if there's a problem with the jaws. So what we are trying to say is a regular every 6-month visit to the dentist will
Is
do you
mandatory.
good.
Right. Doctor, we have another question on social media, and it is, what is the period of wisdom tooth to come, or can it come at any point in life?
Yes, it can definitely come at any point in life. If there's space in your mouth, it peeps out by the time you're 16, 17, which is the normal age as per textbooks. But kenna log 40 zatakats. My oldest patient was 60 years old when his wisdom tooth was coming out.
Okay.
So there is no age, but after 17 they start popping out.
Okay. Doctor, our next question on social media is, does teeth scaling or cleaning required every year?
So I would rather say amka doctor ashin, dentist ashin वचोंक जाय every 6 months. जरी तर डेंटिस्टाक लागता की deposits आसा, गमजाचो problem आसा, then the dentist will do scaling for you. Okay, it is essential to get a checkup done every 6 months. You may not necessarily need a scaling every 6 months.
Okay. So, but what is scaling, doctor? Is it different from teeth cleaning?
Teeth cleaning and scaling is the same.
Okay.
Okay, teeth cleaning is what we say to our patients, and
Okay.
scaling is a dental
the-
term. Yes,
right, medical term for it.
It's a medical term, absolutely.
Okay.
But tooth whitening is different, and tooth cleaning is different.
Okay. Right.
So, should I elaborate a little on
Yes,
tooth
yes, you
whitening
can,
since
so
we
that
are
they-
there?
yes,
Yes. So there are some people who don't like the color of their teeth. They say mache yellow dista, doctor. Amka mache white zay. दांत एक्चुअली चड वायट चेंज करूंक जायना आमच्यान. आमकां ब्रायट करूंक जाता. तर आमी पयलीं तेंचे क्लिनिंग किंवा स्केलिंग करता, and then you get special products at the dentist which enhance the brightness of your teeth. It takes away the superficial stain. That is called tooth whitening. Not over-the-counter products. Go to your dentist who will prescribe you the correct whitening form, either a strong whitening which the dentist does, or a take-home whitening which we give the patients with special instructions. So that is the difference.
Okay. Doctor, what about dentures? Like later on in life when teeth fall off and you still require a set of teeth to bite, we have artificial dentures that most of the older generation uses.
Uses.
So what are the different type of dentures that are available presently?
Nowadays, dentures is something that people look last at because of the advent of implants. But I'll
Yes.
speak a lot about dentures because that is something that is still very commonly used in Goa. Dentures, are upper and lower. Sometimes they are the full dentures. Okay, आणि केन्ना केन्ना ते वेगवेगळे असता. One is with a metal piece in it, so that gives it extra strength, but it is little heavy compared to an acrylic denture. And you also have small flexible dentures nowadays, especially used when 2 or 3 teeth are missing. Flexible is made from a nylon. So the only drawback of flexible is it gets discolored because it absorbs what we eat in color. So it gets stained. But otherwise dentures are acrylic and they are used very commonly and frequently. And metal is only when patients have a very hard bite and break the plastic dentures.
Okay. Doctor, on the same lines, we have a question on social media that says, are ready-made plastic dentures good to buy online?
No one, it's not one pair fits all or one size fits all.
It's not like spectacles.
No,
that you
it's
can
not
just-
a free size. You have to get the
You have to
size
visit your
taken. You have
dentist.
to visit the dentist. You have to get your impressions taken, molds made, and you have to look beautiful with your dentures. You should not feel like you have them on. So it's very individualistically done. Okay, one denture is only for you because you are unique.
ओके ऑन दॅट नोट इष्टानो आम्ही घेऊया एक लहानसो विसो पळत राहूयात.
नमस्कार, म्हजें नांव दोतोर राजेश धुमे आनी हांव नॉर्थ डिस्ट्रिक्ट हॉस्पिटल किंवा आजिलो हॉस्पिटलान सायकियाट्रिस्टचें काम करता. 29 एप्रिलाक हांव तुमच्या मुखार प्रुडंटाचेर लायव्ह आसतलो हॅलो दोतोर ह्या कार्यावळींत. तर ह्या दिसा आमी घुंवळी वखदां विशीं भासाभास करतले. म्हणजे ड्रग एडिक्शन किंवा घुंवळी वखदाची लत ही कोणाक लागता, कशी लागता, ताजे परिणाम कितें जाता आनी ताजे सायन्स एंड सिम्पटम्स कितें आनी हाजेर ट्रिटमेंट आसा की ना आनी आसा जाल्यार तो खंय उपलब्ध आसा, ह्या तुमच्या प्रश्नांचेर आमी उत्तर दिवपाचे प्रयत्न करतले.
इष्टानो येवकार परत एकदा हॅलो दोतोर ह्या कार्यावळीन म्हज्या सांगाताक आसा डॉक्टर नादिया पिंटो डिसूजा. ती एक वेल नोन डेंटिस्ट. दांता बद्दल तुमचे कितें प्रश्न आसा ते आमकां विसरू नाका. आमचे फोन लायन्स आसा 24904444 आनी 24904445. त्या भायर सोशल मिडियाचेर फेसबूक आनी युट्यूबाचेरूय तुमी आमकां प्रश्न विचारूं शकतात. आमी तुमकां नक्की सगळे प्रश्नाच्यो जापो दितले. So before the break, Dr. Nadia, we were speaking about dentures. An important thing is, so we have to meet the dentist to get a pair of dentures. We cannot just go and buy online and over the counter.
Absolutely.
Which is the age that you would recommend dentures?
Dentures are basically done if your teeth are missing.
Like many teeth missing or
तुमचे
just
सगळे
one or
दांत
two?
मिसिंग आसा जाल्यार then dentures is one option. आनी केन्नाय आमचे तीत दांत सेव करूंक जायना आनी ते काडपाक पडटा, मागीर त्याच जाग्यार आमी डेंचर घालूंक जाता. बट देर आर ऑल्सो अदर ऑप्शन्स नाव डेज. रिमेंबर वन थिंग, यू हॅव टू रिप्लेस अ टूथ दॅट यू रिमूव. इतके दांत आसा, एक काडून कितें जाता, रिप्लेस करना ना, तशें केन्नाच तुमच्या मनांत येवंक फावना. कितें जाता की आमी एक दांत काडटकूच दुसरे सायडीचे दांत दे कम इनसायड, मूव जातात आनी आमचो ऑपोजीट दांत भायर येता. सो देन इफ वी वॉन्ट टू पुट एनीथींग देर ऑलवेज बी अ प्रॉब्लम. So immediately in 1 month's time after you remove your tooth, you have to replace it with either a denture, a bridge or an implant. Next, now you would want to know what is all this I've spoken about.
Yes.
Yes.
So what are implants?
Yes, we'll start with implants. Is one of the latest advances in dentistry, where we have a titanium post that is put in the bone where the missing tooth was. Don't be worried, it's not so scary. It sounds scary, but it is a routine procedure which is less painful than an extraction. So some people don't like to involve their teeth at the side, so they say, doctor, we want an implant. So we put the titanium post inside the bone and we close it up and we wait for a few months, at least 4 months. And then after 4 months we put a small attachment in the post and then put a cap or a crown. Okay, that is how we replace with an implant.
And the implant looks exactly like a normal teeth would?
The crown or the cap that you put is normal. It looks exactly aesthetically. So that's when you have to choose what you want to be done, where you want to be done. Because the way it's done is very important to ensure that the patient smiles perfectly.
Right. So doctor, we have a question that says, what is laser dentistry? Is it painless? Because I think dentists are always identified with pain.
Pain, absolutely.
So,
no pain-free treatment, they say.
Yeah.
What I have come across is that we need a little injection when we do laser dentistry, because yes, there is a slight discomfort that you feel. I do not agree about it being exactly painless, but less pain, definitely. It is one of the latest things where you can do a small surgery without bleeding, and it is very easily done. So that is the latest in laser dentistry.
Okay, we have another question that says, what can one do to overcome sensitivity of teeth? My teeth has become very sensitive after eating or drinking sour food. No effect of using any sensitivity toothpaste. What is the most possible solution?
Okay, the first thing you need to do is visit your dentist and see whether you have any cavities or any defects in your teeth that are causing so much of sensitivity. Secondly, your dentist will tell you a certain way of using your desensitizing toothpaste, okay? And then you should be sensitivity free, okay? But it is a little time consuming. There is a duration of treatment. And as long as you don't have decay or any defects, I think whatever your dentist does with you or does to your teeth is fine, and you'll be fine. By the way, having sensitivity when you have sour foods and sometimes even sweet is normal. So unless it's really bad, you don't have to actually worry. If it's troubling you, please see your dentist.
Okay. On the same lines, we have another question. Can sensitivity be cured by some special toothpaste as shown in most of the ad campaigns?
It's the way you use the toothpaste that may be able to cure
To some
your
extent.
sensitivity to some extent, as long as you don't have any defects in your tooth. Because our tooth is made up of enamel on the outside. So enamel is the one which protects our tooth from any kind of sensitivity or pain or any change that happens in the mouth. And if there is no enamel due to some sort of problem like maybe tooth decay or forceful brushing, some people brush their teeth with a hard brush.
Yes.
All that causes defects in your teeth which will cause sensitivity, and that time you need to see a dentist. No toothpaste will help you.
Like you said, doctor, if you visit any supermarket or store, you will see toothbrushes in different types like hard, soft, medium. So, tuja ispan, which is the best kind of toothbrush that you need to use?
Would we take a rough Scotch Brite and brush our skin to clean our skin?
No.
No, we won't do that. So we have to be gentle with our teeth as well. Use a soft toothbrush. Brush your teeth correctly, properly, with good time, and the softness will see that your teeth are pampered and well taken care of.
Yeah, you should not treat your teeth like the toilet floor and keep scrubbing.
Yes,
it.
no scrubbing your teeth, gentle, because the necks of your teeth, the area of your tooth near the gum, gamzakade jo dantache part asa, to खूप thin, बारीक असा, आणि जरी तर आम्ही खूप फोर्सान ब्रश केले जाल्यार तो सगळो वेअर आउट जाता आणि मागीर सेन्सिटिविटी येता, मागीर डेंटिस्टाकडे वचून ते भरचे पडटा. So it's nice to be gentle. Use a soft toothbrush.
Right.
Yes.
Doctor, we have another question. When teeth are cleaned by dentist, does it affect on the firmness of the teeth?
Not really. It never affects the firmness on the teeth. Kenna already ते tartar or calculus जे दांताचेर जाता तो hard दांतामध्ये hard असता. So sometimes with that tartar, it keeps on accumulating, and your tooth is already shaking. Dentist फक्त ते जे बरे ना ते काढता, ते tartar काढता, त्यांना पेशंटाक लागता की oh डॉक्टरान आमचे दांत लूज केल्या. But that is not a fact. Your tooth is already loose. फक्त तुमका कळना कित्याक ते डर्ट जे आसा इतके ते टाईट असता.
That almost becomes a part of the tooth.
So, that is not good. That is the reason why your tooth is shaking, not because the dentist has cleaned it. Okay?
Okay. Doctor, we have a call, so we'll just take this call. Hello?
Hello.
Yes?
Maria.
What, Maria sang?
मुझे दोन प्रश्न आसात मॅडम.
होय.
पयलो प्रश्न म्हजो, आदी भुरग्यांचे दांत उसळटाय म्हणटा ती दोतोरा पयले वयल्या दोतोर कान आहलोले ते दुदा दांत पडटले म्हणटाले, आनी आतां ते फिलिंग कोत्ता आनी फिलींग कोता आनी थोडे ते म्हणटा तेंचे उसळो लागता मागीर ते काडचे पडटा
होय
जाल्यार हे म्हाका क्वेश्चन म्हणजे मातशें आन्सर कर सारकी जाल्यार दुसरो प्रश्न म्हजो हांव दोतोरा बोले गेल्ले एकदां तो दोतोर म्हणपा लागलो म्हाका सगळे दांत पयले क्लीन करूंक जाय म्हजे अशें क्लीन आसलोले आनी ते सगळे ग्रायनिंगाचो चर करून रगतांबा येवपा लागली सगळे मुगे बरेले दांता इना मेल गेले आनी मागीर ते सणसणे लागले सोंडूय गेल्या सणसण ओनूय गेल्या सणसण मागीर थोड्या थोड्या तेंपान एक हालपा लागलो माझे आज कितले काडू पडले म्हणटरी ते काडना जाल्यार कोंता येना एक मनशा ते जायना
क्लिनिंग
म्हाका दोनी मॅडम आन्सर कर थँक्यू
ओके ओके थँक्यू मारिया बाय
So to go on to answer the first question is दुधाचे दांत दुधाचे दांत म्हणजे ते पडटले दे डोंट रिमेन फॉर एवर तर कितें जाता न्यू दांत भितरल्यान भायर येता तेन्ना दुधाचे दांताचे मूळ ते पोरस जाता म्हणून ज्या दांताक फिलिंग आसा केन्ना केन्ना ते परत दुखूंक लागता मागीर आमकां एक्चुअली त्या दांताचेर रूट कॅनल करचें पडटा पण लोक मानिनात कित्याक तो दांत पडटलो म्हणून बट माय एडवायस इज or the dental fraternity will say never remove your milk teeth दुधाचे दांत केन्ना काडनाका कित्याक जे फुडले येतले ते मागीर सारके आपल्या जाग्यान येवचे ना आनी मागीर बेश्टे भुरग्यांक ब्रेसीस घालचे पडटले सरयो घालच्यो पडटल्यो स्ट्रेट करपाक सो व्हेरी इम्पॉर्टंट इज वी विल गेट आवर चिल्ड्रन टू ब्रश देयर टीथ फ्रॉम द टाइम दे आर स्मॉल Let's and then make them maybe brush their teeth, chocolate biscuit together,
gargle them out.
and yes, make them brush their teeth. So दुधाचे दांत खूप गरजेचे प्लीज ते काढ नाका आणि त्यांच्या
व्यवस्थित काळजी घेऊन जाय.
होय काळजी घेऊन जाय होय
The next question
आणि
that she
दुसरे
asked.
क्वेश्चन there are different medical reasons as to why your teeth also start shaking. Normally in adults we see that patients who have diabetes they have a lot of problem with shaky teeth. जरी तर पेशंटाक डायबिटीज आसा तेन्ना तेंचे दांत हालतात वास येता आनी केन्ना केन्ना थंय तेंकां ते टाटर कॅल्क्युलस ते डिपॉझिट्स आसता डॉक्टर साफ करतकूच न्हू ते हालूंक लागता कित्याक ते पयलीं सावन हालतात पण ते गम्स सारके पेकना कित्याक डायबिटीज हाय आसा जाल्यार म्हणून वी हॅव टू मेक अ कंबायन्ड एफर्ट डायबिटीज डावन डेंटल ट्रिटमेंट एंड देन वी वील बी एबल टू डू something good for the patient. केन्ना केन्ना चड दांत हालतात तेन्ना तांकां दवरून फायदो ना कित्याक तो दुसरो दांतूय पिड्यार जातलो ताज्या सायडीक कित्याक एक दांत हालता म्हणजे तेजे सायडीक हार्ड ना देर इज नो बोन टू होल्ड युअर टूथ सो इफ यू कीप दॅट टूथ इट डॅमेजेस द नेक्स्ट टूथ बिकॉज इट ईट्स द बोन ऑफ द अदर टूथ ऑल्सो आय होप दिस हॅज आन्सर्ड Maria's question.
ओके दोतोर डू यू थिंक गरजेचे आमी आमकां कितें मेडिकल प्रॉब्लम्स आसा किंवा आमी कितें मेडिसीन घेता ते आमी आमच्या डेंटिस्टाक सांगूशें जाय अशें तुका दिसता
हय खूब गरजेचे रिमेंबर युअर माउथ इज युअर गेट टू युअर बॉडी जरी तर केन्ना केन्ना आमकां डायबिटीज ल्युकिमिया कॅन्सर हाय ब्लड प्रेशर
लो प्लेटलेट काउंट्स टायप ऑफ मेडिसिन्स सगळे दांताचेर आनी गामजाचेर ऑब्जर्वेशन करतकूच आमकां ते कळटा की कितें तरी रॉंग आसा सो इट इज व्हेरी इम्पॉर्टंट दॅट द पेशंट इज ट्रुथफूल एंड ऑनस्ट विथ द डेंटिस्ट कित्याक केन्ना केन्ना लोक सांगिना आपूण एस्पिरीन घेता म्हणून दांत काडटकूच मागीर रगत व्हांवत आसता मागीर प्रॉब्लेम जाता हय केन्ना केन्ना लोक म्हणटा ना डॉक्टर डायबिटीज आसली पयलीं आतां ना दांत काडटकूच मागीर गांवत पेकना मागीर खूब प्रॉब्लेम जाता ते सगळे सेव करूंक आमी डॉक्टराक सगळे सांगूंक जाय इट इज व्हेरी इम्पॉर्टंट टू टेल युअर मेडिकल इश्यूज टू युअर डेंटिस्ट या हिस्ट्री इज व्हेरी इम्पॉर्टंट सो दॅट युअर डेंटिस्ट कॅन अकॉर्डिंगली ट्रीट यू
एब्सोल्युटली
ते भाशेचे अँटीबायोटीक आनी मेडिसीन त्या वेळार दिवंक जाता
yes we specially treat those with medical treatment with medical conditions we give them antibiotics or we tell them to stop their aspirin but this is all done under their doctor's guidance
yes
we get a letter from the doctor stating that we can do the procedure only then we go ahead to do the procedure for the patient.
ओके दोतोर आतां दांत किडेता तेन्ना तुमी फिलिंग करता न्ही सो फिलिंग कशे तरेचे आसता इज देर वन पर्टिक्युलर टायप ऑफ फिलिंग ऑर देर आर मेनी टायप्स ऑफ फिलिंग्स दॅट कॅन बी डन
There are different fillings that can be done. As all of you must have seen the old silver fillings.
Yeah, and there
that was
gold
very
also.
common. The silver fillings. Doctor, आमच्या दांतान silver नाका. आमका white fillings जाय. So now is the age of the white fillings, the tooth colored fillings. जे दांता भशेन.
Which makes it look more natural.
So you have glass fillings and you have the composite. Sometimes you must have seen the dentist using a blue light. You know, that makes the filling hard. Those are the latest technologies,
Okay.
which you cannot see the difference between your tooth and the filling.
Okay. So doctor, is there some best type of filling or is it like based on the cavity and based on the tooth and the patient's condition do you decide the filling?
Yes, actually you have to see the type of decay pattern in a patient's mouth when you decide to do a filling.
Okay.
Okay, and then you go ahead and do that. Okay, that is just the thing. There are some people whose teeth are very acidic. The mouth is acidic, lot of decay. There we will go in for something that releases fluoride.
Okay.
Okay, something that will also give it a little strength before we do something major. So we have to check on the condition of the remaining teeth.
Okay. So on these lines, there's something called as root canal in dentistry. So what is root canal? Could you explain something on that?
जेन्ना किडलेलो दांत चड फोडटा डॉक्टर म्हणटा रूट कॅनाल करचें पडटा म्हणजे कितें सो आमच्या दांतान मूळ आसता रुट्सान एक नर्व कॅनाल आसा तितून रगत नर्व फायबर्स सगळे आसता केन्ना इतकें इन्फेक्शन जाता तो दांत पिड्यार जाला म्हणून कितकें इन्फेक्शन जाता की ते थंय मातेर भरूंक लागता दॅट इज पास or infection. So we have to clean the nerve canals. That is called the root canal. So cleaning of the nerve canals and removing all the infected little remnants of the nerve from the canal in the roots of the teeth is called the root canal. Third zale no information.
No.
Na?
No.
Okay.
On the same lines, we have a question also that says, Dotor, 10 years back I did root canal, but I did not put a cap. Can I do it now? So what is this cap that is being put?
रूट कॅनाल करता म्हणजे तुझ्या दांतान जीव ना देर इज नो लायफ इन युअर टूथ
Okay.
कित्यानो जीव ना तेन्ना ते बेगीन मोडटा पान पळय पानां झाडाची पडटकूच ती ड्राय जातकूच
ती पडटा.
येस इट गोज इन टू पीसेस सिमिलरली युअर टूथ अँड वेन यू बाईट देर इज सो मच ऑफ फोर्स that your tooth will break. So that is why we request our patients to put a covering on top of the tooth, which is called a cap or a crown. To answer the question, if the tooth is still perfect, then yes, why not? You still please go ahead, get an X-ray done before you put a cap, and if all is fine, please go ahead and put a cap now to save your tooth further.
ओके दोतोर खूपदा अशें जाता की आमी जेन्ना पडटा or there is some accident that happens and we lose a tooth or part of the tooth breaks तेन्ना मागीर कितें करचें आसता is there some solution to that?
Actually there are nice solutions. We only have to make people aware. केन्ना पडटकूच आख्खो दांतूच भायर येता
हय नाजाल्यार अर्दो दांत मोडटा
हय.
then we see a lot of people with half
Yes,
tooth
half
half
tooth.
in the mouth.
पयलीं वेन द आख्खो दांत पडलो जाल्यार तो सारको सांबाळून जाय कहो डोंट वॉश इट एंड स्क्रब इट जाता जाल्यार ते पुट इट इन कोल्ड मिल्क थंड दुदान ते घालून की कितें थंड उदकान घालून बेगीन डेंटिस्टाशीन मेळो कित्याक तो सारको आसा जाल्यार परत घालूं शकता नंबर 1 सो यू कॅन सेव द होल टूथ दॅट हॅज
This is newer practices in dentistry.
yes then second thing is केन्ना तो अर्दो मोडलो जाल्यार वी हॅव टू चेक कितें ते नर्वाक लागता ते नसाक लागल्या गाय चड डीप आसा वी टेक एन एक्सरे नाव वी कॅन डू अ CBCT स्कॅन टू टेल अस एक्झॅक्टली की दांत भितरल्यान बरो आसा की ना मागीर रूट कॅनाल करचें पडटा केन्ना आनी ताजे वयल्यान मागीर एक बिल्डअप करूंक शकता बिल्डअप म्हणजे वी टेक स्पेशल फिलिंग मटिरियल जो दांता भाशेन दिसता तसलो व्हाईट कलर अँड वी बिल्ड अप युअर टूथ इफ नॉट आफ्टर सम टाइम वी पुट अ कॅप चड आनी चड दांत ना जाल्यार people will also go in for an implant or a bridge.
ओके, बेस्ड ऑन द एक्सटेंट ऑफ इंजरी.
Yes, extent
कितलो
of
तुजो तूत आसा आनी कितलो सेफ जावंक शकता पळय तो.
Absolutely, yes.
दोतोर, आनी एक क्वेश्चन आमकां आसा, वेन टू स्टार्ट एंटी प्लेटलेट मेडिकेशन post tooth extraction and prior starting with tooth extraction, like how many days gap should be between antiplatelet and tooth extraction?
So this is a very important issue, and I request you to directly speak to the physician you are under, because as a dentist I cannot tell you to stop any of your medications.
Yes.
Okay?
Because antiplatelets are there for a reason.
Yes,
So when you
yes.
stop, there will be repercussions on it.
Yes.
So your doctor, your general physician is the
Yes.
right person to advise you when to start
Absolutely.
and when to
stop.
stop and when to restart the medicines.
It is always nice to get a written letter from your physician saying
Right.
that the patient can undergo dental treatment and what has to be done. In this way, the physician is aware that they have sent you for your dental treatment.
Okay.
So that is important, okay? You're only under your physician.
Right.
Yes.
Doctor, do you think when you look into somebody's mouth, can you predict their, medical history or their sickness? Does it give you a preview of what is going on in the body?
Normally, with respect to diabetes and like acidity, yes, you can definitely observe it when you check the patient, examine the patient's oral cavity, the teeth and the gums.
Okay.
Because there are small signs that we can see
Right.
if the medical health is not good.
Okay, doctor, we have a call, so we'll take this. Hello?
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 Hello? Why children get extra teeth?
Sorry?
Why children get extra teeth?
Why children get extra teeth? Right.
Yeah.
Okay.
And
And?
yes, like that.
Anything else?
And that too,
Okay.
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 So some children, their milk teeth don't fall off.
Yes.
Okay, so they have double teeth because they have दुधाचो दांत असता आणि परमनंट दांत असता ताज्या फाटल्यान. दुसरे म्हणजे तेजे दुसरे परमनंट त्याच टायमार येता आणि सगळे खूब दांत असता. सो जेन्ना
ते extra
हे
जाता.
जाता तुम्ही प्लीज डेंटिस्टा कडेन दाखय, कित्याक ते दुधाचे दांत काडूंक जाय, so that the permanent teeth can come in its place. There are some conditions where people get extra tooth. They get an extra tooth behind or an extra tooth in front.
At the
They are-
incisors.
Yes, they are the lucky ones.
So they can bite extra.
Yes.
Right.
So always show your dentist. दुधाचे दांत जरी तर पडूंक ना आणि परमनंट दांत येयल्या जाल्यार ते दुधाचे दांत काडचे पडटा, पण तुझ्या डॉक्टराक दाखय ते पयली. ओके?
Right. Doctor, we have another question that says, what is the difference between polishing and whitening? Is it the same thing?
Normally after we do tooth scaling, sometimes the teeth are rough. So we take a brush and a certain material and we just rub that brush with our motor onto the teeth using that material. That smoothens the teeth. That is called polishing.
Okay.
Okay, where your teeth are smooth. But whitening is when you use a special chemical
To make
to
it,
make it
to
brighter.
change the color.
Yes,
make it
to make
brighter.
the teeth brighter. This is all done, whitening is done after scaling and polishing.
Right.
Okay.
So doctor, would you advise certain kind of foods that are healthy for maintaining tooth health?
Yes, like I said, some fruits are really good, like apples and papayas. Sweeter fruits, they also cause cavities, so that has to be avoided. Okay, the very sweet fruits. But otherwise, generally fruits are okay. Then we have nuts, which are also good. Soak the nuts so that they are gentle on your teeth. Don't go scrunching them. Your teeth also need your tender loving care, just like the rest of your body.
Right.
Then you have cheese, which is also good. I normally tell my friends that their children should be given a little cheese bit in their tiffins, so that at the end they'll have a little cheese in their mouth, which will not allow decay to happen immediately. It like just stays it for a little longer. And of course,
And calcium supplements also, right?
So in that case, we have to check our vitamin levels, our calcium levels, check on the nutrition of a child, and with a pediatrician or a pediatric dentist. Then we decide that the child needs or the person needs any extra supplements like calcium or vitamin D.
Right. So, Doctor, I'll take this last question, and I think with that we will keep this as a take-home message to all our viewers. The question is, what are the things to keep in mind for good health of teeth and mouth?
The most important thing that we need to do is remember that all our teeth, 28 to 32 teeth that we have, are very important. Each and every one is important. You have 10 fingers. If one is not good, will you cut it? No, you will save it. Same way you have to save each and every tooth of yours. How will you do that? One is you will try to have a good diet. Involve food that does not create cavities. Nuts, cheese, that is very important. It prevents decay. Second is दोन फावटी आमी ब्रश करूंक जाय. ब्रेकफास्टा उपरांत आनी न्हिदचे पयलीं.
Okay.
दोन फावटी. दर ऑल्टरनेट दिसा फ्लॉस करूंक जाय आनी एवरी 6 months डॉक्टराक दाखोवंक जाय. डेंटिस्टा कडेन वचून तेंचे एग्जामिनेशन, दांताचे एग्जामिनेशन करूंक जाय. स्मोकिंग, शार्प टीथ, alcohol, very spicy is all bad for your gums and the soft tissues of your mouth. If you take care of your teeth carefully, nicely, tenderly, they will take care of you.
Yeah, I think, Doctor, that's a very nice sentence you said. If you take care of your teeth, they will take care of you. Thank you, Dr. Nadia. You came on our show, and I think you've shared with us so much valuable insights about tooth and teeth health, dental health. Thank you so much. इश्टानो फुडल्या शुक्राराक परत मेळा आनी एक तज्ञ दोतोरा वांगडा. डॉक्टर राजेश धुमे आमच्या सांगाताक आसतलो. तेन्ना तुमचे प्रश्न तयार दवरात. तो मेरेन पळत रावात प्रुडंट. टेक केअर आनी मोग आसूं.
नमस्कार, म्हजें नांव दोतोर राजेश धुमे आनी हांव नॉर्थ डिस्ट्रिक्ट हॉस्पिटल किंवा आजिलो हॉस्पिटलान सायकियाट्रिस्टचें काम करतां. 29 एप्रिलाक हांव तुमच्या मुखार प्रुडंटाचेर लायव्ह आसतलो हॅलो दोतोर ह्या कार्यावळींत. तर ह्या दिसा आमी घुंवळी वखदां विशीं भासाभास करतले. म्हणजे ड्रग एडिक्शन किंवा घुंवळी वखदाची लत ही कोणाक लागता, कशी लागता, ताजे परिणाम कितें जाता आनी ताजे सायन्स एंड सिम्पटम्स कितें आनी हाजेर ट्रिटमेंट आसा की ना आनी आसा जाल्यार तो खंय उपलब्ध आसा, ह्या तुमच्या प्रश्नांचेर आमी उत्तर दिवपाचे प्रयत्न करतले.